Kidney stones. If you ever had one, you know they're extremely painful. You have to pee a lot. You're having back pain. The pain is so intense you throw up. This is something you want to check out immediately because you could be passing a kidney stone. You may have multiple kidney stones. So how do kidney stones form? There's usually three ways, possibilities. One, is there a genetic vulnerability? Does someone in your family have kidney stones? Have you had kidney stones? Then you know that there's your vulnerable spot. For instance, my mom had kidney stones and one of my brothers has kidney stones as well. So there are certain things that we'll talk about the strategies of what you can do. The other is kidney stones could be caused by oxalates. And oxalates is a food chemical found in, unfortunately, really healthy foods such as spinach and Swiss chard and chocolate, as well as sweet potatoes. So you want to make sure if you're vulnerable to kidney stones or you feel like you're having a kidney stone attack, go on a low or no oxalate diet. So stay away from all the foods that have oxalates in them. Now, oxalates bind with calcium. So individuals will tend to have some oxalates with calcium or take calcium citrate before a meal, so that calcium binds with the oxalates so it never gets to the kidneys and it never forms a stone. That's if the stone was from oxalates. The other is uric acid. So a kidney stone could be caused by uric acid, and that's from our red meats and our shellfish. So if you are experiencing kidney stone issues, you want to ask your doctor, is this stone from uric acid buildup or oxalate buildup? So you know which direction your diet should go into. If the doctor or practitioner cannot supply that information, then I would advise keeping a food journal and documenting what you eat, how much you're drinking, so you could make sure you're balanced, having low oxalates to no oxalates, as well as looking at the foods that would cause the uric acid buildup in addition. So what type of treatments? Conventional treatments would be that they would use some type of wave treatment to get rid of these kidney stones. Another, if it's depending on the severity and what phase you're in, another would be to give you potassium. So here you want to ask your doctor, look at how much potassium they are recommending, and lots of times the doctors unfortunately will give you potassium, but they'll have like red dyes, blue dyes, other dyes in them. It won't be all natural. So look to see if you could get potassium that matches the dosage your doctor wants, that doesn't have all the added junk, right? I know for many people, actually boiling celery and drinking the celery juice when it cools off a bit, like a tea, really helps dissolve the kidney stones. Another would be dandelion tea, or even boiling dandelion and drinking that water. But obviously you want to ask your medical practitioner. There are other supplements like this kidney bladder supplement. Ask your doctor if this is something that they will approve for you to have on an ongoing basis, or after this kidney stone attack goes away, can you take this as a maintenance? And ask them if you're allowed to take this, and ask them how often you could take it. You definitely have to be under the care of your medical practitioner, and you want to get their approval for all of these things, as well as the dandelion tea, the celery, seeing if you could take this kidney bladder. There's homeopathic remedies called kidney drainage. Again, hopefully your medical practitioner will be into some alternative treatments as well. Remember to stay away from all salt. Don't put it in your diet whatsoever, and make sure you're drinking enough water. Also, stress comes into play. You know, we're dealing with uncertainty in these times right now, and some unrest, and the stress can be attacking us internally without even knowing. So find stress reduction, stay hydrated, look at your diet to remove oxalates, make sure you're not having any foods that are building up uric acid. Ask your medical practitioner if they know if this is from oxalates or uric acid, and also ask about calcium citrate. Ask if you could get a healthier version of potassium, and if you could have these type of kidney drainage, kidney bladder supplements to support you during this time. In addition, you want to make sure that the supplements you're taking, you just want to focus on the kidney right now. So too much vitamin D, too much vitamin C, but depending on the source, is the vitamin C from oxalates or not, can also contribute to this. So there's a lot of factors that go into this. And I would definitely just focus on taking supplements that are going to support the kidney drainage. So see if you could take a kidney bladder type of supplement, your potassium if it's what you need. If it's from oxalates, ask your doctor if you could take calcium citrate, and then a probiotic just to even out everything in the gut, deal with stress, hold off on other supplementation unless you get doctor's approval for now, and really look at your diet, keep a food journal. Kidney stones are very painful, and you always want to look at your diet to see perhaps, even though spinach and Swiss chard and all these green leafy vegetables are so healthy, and many fruits like berries are very high, and even kiwis are very high in oxalates, this is the time to go on a low to no oxalate diet. Also, look at your uric acid. Make sure the red meats or shellfish, everything in moderation, and ask about calcium citrate, your potassium, if you could get a healthier version, if the doctor is giving you something that has dyes in it, or titanium dioxide and other additional ingredients that aren't the healthiest. Ask them if you can have dandelion tea, celery, as well as a kidney bladder supplement, so you reach optimal health, total wellness of mind and body. Remember, your health is worth it because you are worth it. Bye now.